Cullinan's contribution.
Thank you. Minister, health waiting lists, as you have conceded yourself, are dangerously high. And it isn't just the number of people who are on waiting lists, but it's also the length of time that people are on waiting lists is the problem. 893,040 people are on an acute hospital waiting list. 731,797 of them are on active waiting lists. 226,966 people are waiting for a diagnostic assessment, Minister, and 224,631 more people are on primary and community health waiting lists across mental health, disabilities, older persons and many other areas as well. That's an astounding 1.34 million people on some form of health waiting list. 10,000 more people were added to our acute hospital waiting lists in January of this year, Minister. 10,000 people this month were left on hospital trolleys in corridors right across acute hospitals in this state. In January of this year, 1,100 people over the age of 75 were on a hospital trolley for more than 24 hours in acute hospitals. Can you imagine 1,100 people in 1 month over the age of 75 left on a hospital trolley for more than 24 hours? It's quite astounding. People are now waiting for GP access, sometimes days, Minister, sometimes weeks. Out-of-hours services is patchy in some areas and non-existent in others. And all of that, as we know, is adding to the pressure in our acute hospitals, because if people can't get access to GP services, they're left with little choice but to go to our emergency departments in acute hospitals. Dentists are leaving the dental treatment service scheme, Minister, at a rate of knots, and we have really high wait times for orthodontic treatment and for children waiting for dental treatment under general anaesthetic. We also have tens of thousands of children waiting for access to services, children with disabilities, waiting for speech and language therapy, occupational therapy, physiotherapy, child psychology. Right across the board, we see high wait times. Audiology, where children and adults are waiting again a long time for a hearing test, a hearing aid, children needing grommet insertions. All of these are again examples of high wait times right across the system. We also know that the National Ambulance Service is chronically understaffed and needs to be resourced. Minister, last week you published your waiting list strategy, and I pointed out to you at the time there was no additional funding beyond what was in the budget. It was a repackaging of measures which were already provided for. The only way to tackle waiting lists, Minister, is to put capacity into our hospitals. And I acknowledge that there was additional capacity put in over the last 2 years. And I welcome every single cent that's put into our health service in additionality. I welcome every single additional staff member, every consultant, every nurse, every healthcare assistant, every home help worker that's employed in the public services. In addition, I support it and I welcome it and I celebrate it. But you know as well as I do, Minister, that we've had decades of underinvestment where many hospitals don't have the inpatient beds to admit hospitals in the numbers that they need. We know we have a deficiency in some areas in community beds and step-down beds, so patients can't be discharged quick enough. You know there is problems with surgical theatre capacity, diagnostic capacity, and not just in relation to children with scoliosis, but right across the board, Minister. And in the HSE service plan, which was announced today, it talks about more reporting structures, more bureaucracy, when really what we need is less tiers of management and more accountability. That's what's really needed. Deliver the regional health areas that actually devolves responsibility down into those regional health areas and down onto the floor of the hospitals where hospital managers are more accountable. We need to take a zero-tolerance approach to emergency department waits. One of the things that our motion is calling for, Minister, is a job guarantee for all health graduates that come through training places in this state, because we need to train more, and you would accept that yourself. We need a workforce planning strategy, we need to recruit more staff, and we need to retain them. So I read your amendment, Minister, which was nearly 4 pages long, and can I say to you that what we need is less spin, less spoofing, We need more substance, we need more efficiencies, and we need more capacity. And without that capacity, without those efficiencies and reform changes which are necessary, and without the substance, unfortunately, Minister, what you will be left with is more vague targets and more missed targets, as previous ministers have found out to their cost.
The current number of patients on waiting lists in my own constituency is difficult to take in. Currently, there's a total of 8,866 patients on waiting lists just for the inpatient care in the Galway University hospitals. And of course, Minister, as you know, there's a story behind every single one of these figures. A person in need and a family that's just so worried. And shockingly, over 2,000 of these have been waiting for more than 18 months for an appointment. And look, Minister, we all have stories of people who've been languishing on these waiting lists, but I do think that it is important to highlight really the human cost of these waiting lists, and to show that these are not just figures, but that they're real life experiences for thousands of people. And Minister, one of the families contacted me over the summer, where one man who had been waiting since 2019 for treatment, they told him it would be at least another year before he would be seen as a public patient, and his condition was such that if he waited to get surgery, it would spread to other parts of his body and just get worse. And Minister, for outpatient care in Galway University hospitals, it's even more shocking and staggering, the figures. We've over 50,000 patients waiting for an appointment, over 30,000 of those waiting for over 6 months now, and that's only including the adults. We see even more in terms of children, and I have to say, Minister, we're really failing our children. Araton Lissi Fehev Umland Dochrecha Gun Hospital in Alia, and so Kun 8,800 in a fast, like Fanator Honik, Koni Hocha, Linis Muna Ravila Akob, Ek Fanach Nis Fuja, Noblian Gale. Ter scéal te hier de chulachán in the figure sin, ag scéal de rinne atá follings, agus nui chailach atá frí vrú. Agus nui tá an freisin go golóir páisteag fannacht ar na listí feitheamh seo, cá muid chulachort a dhéine chun cheabhrú lob, agus a súlam go dacu tú leis an rún inacht.
Paula Tommy chun áireacht a déanamh leabhart as gaeilge de seachtain a gaeilge. Bhí crúnú dearfach a gom in é le fuireann an HSE san úna cuireann príomha údálach. Túgu cuire dom fécinn cád is féidir le ina cuireann sláinte príomhúil cór fáil. I mai á clia hiarháin fós níl inar cuireann sláinte príomhúil a gcuin. Tá obair túisia I glún ghlacán agus tá an mhuinú ann don obair planála dúrúlach. Tá Sívana fedéirte ann I gás leabhachan agus baile adam. Seo os atá díí go géir ina gceantar. Deas gael nuachta amháin am a gcuirt na go fóca mé os tá stála crí gór féidir le doctorí a túrú a déireach. Leidíonn sé seo brú ullmhór do ranógaí ag an dála, seo tógrú atá muoinethe trí sláinte céir. Tá cían a muoine seo le báil go lé faoine agus tostain níos mo muoine. Le rion sa cád is féidir a déanamh má leanan an rialtas an plán. Minister, yesterday I had a very positive meeting with HSE staff in Primary Care Centre in Tala. I was invited by the HSE to see first hand what a modern day primary care centre can offer. In Dublin Midwest, it's a huge population. We don't have a primary health care centre. Work has begun in Clondalkin, and only last week we were told that funding is there for design works for one in Rolla, and there's been possible locations for Luke and Adamstown. And this is a facility that our area desperately needs, Minister. But one good news story, and this might help you from my visit, was to see a heart screening facility up in Tala, where GPs can refer directly into the primary healthcare centre. This takes huge pressure off the emergency departments. It's an initiative funded through Sláinte Care. This funding provides for only 1.5 staff, and there needs to be more funding. And it shows what can be done if the government follows the blueprints that are there. And so this is a very simple thing that Sláinte Care has funded that is working. And if it was funded more, it would take the pressure off all the numbers and all the figures and that Mairead and Deputy Cunningham has mentioned about being on the waiting list. And it'll be one way to do it. So something's working. It's not rocket science. Follow up.
Let the whole.
Count Corla. Minister, our hospitals are at breaking point. There's 1.34 million people on health waiting lists. These are not just statistics, these are real people. Many of them contact their local TD looking for assistance. It shouldn't have to be this way. Why should it take a letter from a TD before action is even taken, even if it is only in limited circumstances? I had a man call to my office before Christmas. He's on an ENT waiting list in Tullamore for 5 years. He received a letter about a year ago asking if he still needed to be on the list. Now, Minister, either if he had died or experienced a miracle, of course he needs to be on the list. What he has doesn't go away, and we need to be sensitive to people like this. Before Christmas, he then received a letter inviting him to attend a private hospital, where a consultant had told him he would have an MRI within 10 days. We're 10 weeks on now, he still hasn't had the MRI. So we built somebody up to knock them back down. Simply not good enough. Behind each and every one of these numbers is someone who is suffering. There are older people dying while they wait on hospital appointments. I have lots of people coming to me with children who are waiting to have their appointments for their tonsils to be removed. Children that are experiencing recurrent sore throats with all the pain that comes with them. Children waiting to get grommets who are being delayed developmentally because hearing problems are not being addressed. This is not acceptable. But at least they're in the system, broken and all as it is. Because if you live in South Kildare or Portarlington or County Laois, you can't even get a doctor's appointment. There's a massive shortage, and ye in government are doing nothing about it. I've written to the department, to the HSE, I've asked parliamentary questions, and the answer coming back is they're private businesses, and they can operate where they like. That is an absolute cop-out, and you know it. We need GPs, we need them now. There is far too much hand-wringing and whataboutery. There is a political will on this side of the House to address the shortage of GPs, to address the shortage of dentists and the ridiculously long waiting lists. So I'm asking you, Minister, to do the right thing here, and please accept this motion and act upon it. Thank you.
Minister, today at Letterkenny University Hospital there were 10 ambulances backed up at the emergency department. An unprecedented crisis in that department in terms of staffing. Morale is extremely low, and this is a build-up of a failure to invest in beds, nurses and doctors at the hospital for far too many years. If you look at the size of Letterkenny University Hospital, the major acute hospital in Donegal, it's the 6th largest hospital in the state. Over 23,000 inpatients every year, the 6th largest, a major hospital. But if you look at the funding for the hospital, it's down around 13th or 14th. It's been clear for so many years that it has not received the budget that it requires. You have a profound crisis of morale of staff in that hospital, but yet they go to work every day in what can only be described as heroic circumstances. But they're tired of being called heroes. They need the backing. And I want to say this, that crisis feeds into the waiting list crisis. And if you look at right now, just in Letterkenny alone, if you throw in Sligo, it's even more. But there are 21,500 men, women and children on the waiting lists for Letterkenny Hospital alone. If you add Sligo, it's probably about 26,000 men, women and children out of a population of 160,000 that are on waiting lists, many of them for over a year, over 2 years. This is the crisis that's created of years of neglect. Community hospitals in Donegal, 1 in 4 beds cut in the last 15 years in community hospitals. So you're cutting community hospitals, you're not resourcing the major hospital, and the impact is what you see today, 10 ambulances backed up, staff at crisis point. Minister, I'm asking you again, please go and personally visit Letterkenny University Hospital as soon as possible, speak to the unions, speak to the staff and speak to the management and make the intervention that's required.
Minister, first of all, I want to commend my colleague David Cullinan on the work he's doing to highlight the dreadful situation where we have over 1.3 million people on a waiting list for some sort of health service, and they're waiting not months, they're waiting years. I'm inundated with parents of children with disabilities or additional needs who are looking for assessment of need or early intervention. Early intervention is key, but it's not being provided. I had the parent of a teenager contact me recently. He's waiting on a procedure. He's been called 4 times since last April for this procedure, and 4 times it was cancelled. In fact, 2 of the times he and his mother were actually in the hospital when he was told the procedure couldn't go ahead because the previous one had overran. I have another man who had very poor health for 3 years, had gallstones removed about 2 years ago, was told he needed his gallbladder removed, has not had a call back to the hospital, cannot get any information, is being left there very, very unwell with no end in sight. Another woman can't sleep at night with the pain in her hands because of the carpal tunnel and she needs surgery. She's been told she'll have to wait another 4 to 6 months. She's been already waiting 4.5 years. Another person can't get a procedure done because there are insufficient anaesthetists in the hospital. So again, no end date and no procedure in sight. In Cavan General, there are almost 6,000 adults and over 500 children waiting for outpatient appointments. There are more than 500 adults awaiting inpatient care, and 20% of those are waiting in excess of 18 months. We have 219 children on an inpatient waiting list. More than half of them are waiting for more than a year, and 42% are waiting more than 18 months. I mean, the staff in Cavan General Hospital are excellent, but they are exhausted, they're overstretched, and many healthcare staff are opting to change career or go abroad where your pay and your conditions are much better. Minister, this cannot be allowed to continue. Thank you.
Thank you very much. Minister, firstly I want to start off, whilst I know the debate is about waiting lists, so you won't be surprised, I'm going to raise University Hospital Limerick, and unfortunately today we had an incredible 90 people on trolleys there. Every single day in February we've had 50 plus people on trolleys, which is a record, unfortunately, for the amount of people on trolleys. University Hospital Limerick across the whole of February has broken records, unfortunately. The highest number on trolleys for any hospital in any month since these records were established, which is a truly shocking figure. Minister, I do know you visited the hospital recently, and I was disappointed, and I called you all the time. You didn't actually speak to the unions there, and they were very disappointed you didn't sit down and speak with them and listen to what they're saying, not just exactly what the management are saying to you. I have attended the hospital myself on a number of occasions. I went there recently with Deputy Cullinan, and we met senior clinicians, we met the CEO, we met other people. The hospital is under huge pressure for the amount of people who have to access the hospital. It is the major hospital for not just Limerick, it's for Clare and North Tipperary as well. People from North Kerry as well will travel there. But people, you know, and there's multiple reasons why our hospital is crowded. And Deputy Cullinan again referenced the issue of GPs and getting access to see your GP is becoming increasingly problematic in Limerick City. So people are going to hospital in some cases where they don't have to because they can't see a GP. So we do need to sort that out as well. But Minister, some of the promises that are done for University Hospital Limerick won't be delivered for years, as you well know. The new 90-bed unit is only going to deliver 48 of those. This hasn't even been fully committed to yet. There's no build on that, obviously. Some of the stuff that needs to be done, for instance, getting people out of the hospital who are recovering but still need care. You know, there's no primary or step-down packages for those. By and large, they're delayed. Home health cares are, I think there's 8,000 home care hours approved in Limerick area, but there was nobody to actually do them. They haven't been assigned to people, so we do have a problem there as well. You know, this just simply can't continue, Minister. I know you went to the hospital, but look, as I said, you didn't actually meet the unions, so it would have been very useful, and I would encourage you to actually meet the unions, even if you do that in a Zoom meeting. Also, you know, we are talking about lists. We need to have accurate lists, so we need to publish monthly updates on the number of patients added or removed from lists to ensure an integrated and collaborative healthcare system across primary, community and acute services at regional level. So we need to know exactly how many people are in the hospitals, how many people are waiting for the hospitals, how many people can't access a GP, for instance. You know, we'll all have dealt in our constituency offices, people coming to us, children waiting for child psychologists, waiting to be assessed, waiting for months and months and with no time for it. And it's absolutely ridiculous that people have to come to the TD to put in a parliamentary question to the Minister for Health to try and access basic health services that are critically needed. And the longer you wait, Minister, you know, the worse outcome you're going to have. So we do need to get our house in order. It can't go on, and University Hospital Limerick is shaming all of us.
Kate Chachter and Lista Rose Conway Walsh.
Minister, the Mayo University Hospital waiting list has increased by 162% since July 2015 to July 2021. And it takes 712 days for people to get general surgery. There are very, very severe regional imbalances to be addressed. Now, I really listened to some of the things that you had said, and one of those things was about delivering care close to home. Minister, will you talk to the workers and talk to the managers you've appointed making the decisions? Because what they're doing is closing down every possible local service that they could close down, including Belmullet District Hospital. We need some joined up thinking. That's what they're doing, Minister. And you need to go and see them, and you need to confront them, and you need to, as Minister for Health, you need to not let this happen. We have been fighting for years and years for Belmullet Hospital alone, and that obviously has the impact of people going to Mayo University Hospital and taking up beds there and trying to get treatment there in the acute hospital. There is a total lack of cohesion and integration between primary care, social care and acute care, and it has to be addressed. The other thing, and Minister, I do want to commend the staff, because I'm conscious every time we stand up here to speak that there are frontline workers who are absolutely exhausted and worn out, and so many of them, in their droves, they're telling me, I can't take any more and I'm leaving. They're leaving not because they don't like the job that they're doing, because they cannot stand it any longer. And you will have that at all levels across the frontline workers, because there isn't enough of them in it to do the jobs. They don't have the equipment more often than not. They don't have basic equipment to be able to do their job. We have consultants and surgeons standing by in beds, and they don't have the recovery beds to take the patient in, and they don't have equipment to do the job that they're doing. This is just disgraceful with the money that we're putting into the health service. And it has to be addressed. You know, there has to be systems there. Who is accountable? We cannot find who's accountable within the system. Nobody is accountable for... Sorry, is my time up? Sorry. Okay, I didn't cover half what I wanted to cover.
Very well. Gormagat and agus is rud simúl a bhí ann I ré an garcéim a bhí I Cams I Géirí agus an garcéim eile is an ospedéal I Drálaí mar na leiscéal a bhí ag an rialtas marall na dacrachtaí a bhí cob marall arcíocht. One of the curious things about the recent crisis in Cams and Kerry, and in relation to the ongoing difficulties in Kerry General, in the University Hospital Kerry, has been the excuses about the difficulties that it's facing in terms of recruitment. Beds need staff and consultant vacancies are widespread, say the government. Why would people not come down if there's a salary of 200,000 on offer? However, the new waiting list plan essentially amounts to repackaging a lot of the current difficulties and expenditure and measures. What are we to expect if the investment and conditions do not improve? The CAM scandal, no more than difficulties that other consultants are facing, is as a result of the inadequate resources, inadequate team, and some consultants not even having an office. How do you expect to attract new consultants down to a place like Kerry when the necessary resources are not in place? Worse than that, however, is how the government claims to be trying to address the issues in the public system, tying one hand behind its back. There may be obstacles to the implementation of Sláinte Care, but investment in the public system is the only way to overcome it. Directly employed staff, and what about the salary GPs mentioned in Sláinte Care? There should be 200 of them across the country. I haven't seen any so far. Local government reps in Kerry, however, continuing to advocate and back the private system over the public system, that doesn't help either and will only set up the health system to fail. Elective surgeries, you asked, Minister, what are the ideas that are coming from here? Elective surgeries were postponed in Kerry for a period of 6 months. Most of them have only recently come back, but not all of them. There are still hip and knee replacements being outsourced to a private hospital. You were looking for other ideas, you asked for them. The orthopaedic ward hasn't been done. The colposcopy unit still hasn't been made. The plans which we saw, which the 5 Kerry TDs saw in a meeting last November, 12 months, are still on a desk in Dublin awaiting approval. more staff. I see what you said about all the new full-time staff being added to the workforce, but the difficulty is that nurses and experienced nurses are leaving. So I'd ask everyone, all the TDs, particularly Kerry TDs, to back this current plan, keep the job guarantees to health graduates, reduce the inequality in pay and remove the private practice from the public hospitals. Thank you.
Minister, waiting lists are completely out of control. They've reached the point of being dangerous and people are suffering because of government's failure. Minister, the lack of action on this issue is failing children, it's failing the elderly, it's failing families and it's failing those who work in our hospitals. The cost of this inaction is having a real impact on waiting times and people's lives. Now, your latest plan won't put a dent in the numbers, and if we've learned anything from previous plans, it's that its targets will be missed once again. Now, Minister, in my own local hospital, Beaumont, there's over 31,000 people on hospital waiting lists. Nearly 7,000 of these people are waiting over 6 months just to be seen. Now, I think you agree this is totally unacceptable and ordinary people are paying the price. Now, Minister, I had a constituent who contacted my office yesterday who was recently up in Beaumont A&E, spent 10 hours waiting to be seen. And when he was seen, he was asked, "Have you any health insurance?" He told him that he hadn't. And then he was advised to go get a loan, to go private, which would cost him €7,000. Now, I think you'll agree with me, that says a lot about the state of our hospitals. We all know the staff are doing their best, but they're being held back by decision makers who just can't get their act together. Now, this motion sets out what a Sinn Féin minister would do to tackle this crisis and give hope that things will change for the better. Now, Minister, we need to see a proper plan which looks at why we can't get the staff and how we can increase the training places. Healthcare workers are burnt out and can't get a break, and this needs to change.
The National Treatment Purchase Fund reported that there were 72,684 people on waiting lists in Cork hospitals, almost 30,000 of those waiting over a year for treatment. Now, just to be clear, these aren't people waiting for minor treatments. These are people that are waiting on treatments that are life-changing and in some cases life-saving treatments. There are over 100 people alone waiting over 1 year for cardiothoracic surgery in the CUH. People with heart and lung disease that are desperately waiting for surgery to give them a chance and hope. In the Mercy Hospital, there are over 900 people waiting for pain management. Now, anyone who suffers from chronic pain will tell you, without management, proper pain management, they're not living, they're surviving. But we're leaving people on these waiting lists for months and even years, wasting their lives away because of successive governments' mismanagement of the health service. Sinn Féin have a plan for healthcare in Cork. We will open a new elective hospital on the north side. We won't play politics with announcements of dates and locations, and we won't break promises after the promises on these announcements. We will build it, open it as quickly as possible. Sinn Féin have a vision. David Cullen has a vision that would make the health service an attractive place for people to work, that we would continue to keep those skilled graduates retained and working within the health service. The INMO said in January that trolley figures were spiralling out of control in Cork. In February, they said that it was a dangerous situation. Minister, we are bringing forward solutions. Will you please take them on board? Tardini ar fad, riv fada ar Sarvishi Sláinte. It's time for change. Minister, you said earlier, we're here because of decades of underinvestment. Fianna Fáil and Fianna Gael have been in power for those decades. The Taoiseach was the Minister for Health, the Taoiseach was for the Minister of Health. And for Fianna Fáil to come in here now and say, well, it's the past. Fianna Fáil supported Fine Gael in confidence and supply for 4 years. You're in government for 2 years. Here we are 6 years later now, and we're in a worse position outside of the COVID. We were in a terrible condition before COVID. And my final point to you, Minister, people are sick of excuses. People are sick of the blame game. They're sick of the government not doing their job. And for 900,000 people who are on waiting lists, they're just sick. Go Margaret.
Sinn Féin.
When I spoke about hospital waiting lists in the Dáil in 2018, at the time they were at the highest since records began, with 707,000 patients waiting for treatment. Deputy Simon Harris was the Minister for Health, and he stated that reduced waiting times for patients was a key priority for himself and for the government. He gave a number of reasons as to why the hospital lists were so big and outlined a series of measures to reduce them over time. However, 4 years later, there are now 879,000 individuals currently on waiting lists, of which 96,000 are children. 40,600 people were added to the hospital waiting lists in the past year. Figures also show that throughout 2021, some 114 people were added to hospital waiting lists each day, and for some public hospitals there were 100% increases both in outpatient and inpatient waiting lists. This despite the fact that 1 in 5 hospital consultant posts remain vacant or are filled on a temporary basis, according to the Irish Hospital Consultants Association. Tarn Rudjo e Corbrú Mór Angora Sláinte. Many patients have also had their appointments cancelled, and for those left waiting long periods of time for treatment, they are often left in pain as their conditions get worse. Their well-being and mental health deteriorates with the stress of not knowing when they will have their appointment and receive care. The Euro Health Consumer Index questions why some countries have none or have minimal waiting lists in healthcare. They have achieved their goal by introducing an integrated national real-time e-referral system. The EHCI asks an important question, and that is, if countries with limited means can achieve virtual absence of waiting lists, what excuse can there be for countries such as Ireland to keep having waiting list problems? My experience from my constituency work in Dublin North West is that I have found many cases of people being effectively turned away from hospitals because of bed capacity or as a consequence of a lack of hospital resources, particularly in terms of staffing levels. This has been exacerbated during the last years of the pandemic. Last year, the government has committed itself to implementing a multi-annual plan to reduce waiting lists in hospitals. Where are we with this, and when will we see the results of this commitment? Thank you.
Bowalum on Runshaw Mulla Higon Dal and Octagus Mavuikas a Gowa Leshon Chakta Cullinan as Octan Run a Cor we Vraj to Dalia. Laskin Corla, there are now 1.34 million people in this state on health waiting lists. 893,000 of those are on hospital waiting lists. It is an absolute scandal that has been decades in the making. It's a result of mismanagement, incompetence and a lack of political will to address the gross inequalities that lie at the heart of Ireland's health service. This inequality is illustrated by the undeniable fact that access to healthcare is often determined by one's wealth and where one lives. Week after week, I speak to people waiting for essential treatment for themselves or their children who have been blatantly told that if they can go private, the care they need will be provided virtually immediately. For those dependent on the public system, they tell me, they also tell the government, if they listen, that geography can determine the level of care they receive. All too many of the problems we face originate in the failure to deliver proper working primary care services. In County Monaghan, the decision of previous Fianna Fáil and Fine Gael governments to remove services from Monaghan Hospital continues to have serious negative repercussions. A&E services were withdrawn from Monaghan and resulted in drastic overcrowding at Cavan and Drogheda hospitals. A minor injuries unit was eventually established, a great service that should serve to ease pressure on both GP practices and A&E departments. But the MIU only operates Monday to Friday, 9 to 5, in contrast with most other minor injuries units, which operate 7 days a week, 8 a.m. to 8 p.m. On top of that, for non-GP referrals, there is now a fee of €75 for patients to attend. And the result of this, of course, has meant that the numbers attending the MIU are now reducing, while the demands on GPs and A&E are ever growing. It is as if government is actually trying to make a bad situation worse. So the Minister, Laskin Corla, has asked for practical solutions that can help ease the crisis in our health services. So here's one. Open all minor injuries units, specifically Monaghan, to 7 days a week, long hours services, and remove the fees associated for MIU presentations, because governments refuse to listen when we warn them of the consequences of withdrawing services from Monaghan Hospital. I sincerely hope, Ministers, that you will listen now.
I am proud of the wonderful staff that we have in our health services, and over the last number of months, as they battled through COVID, Minister, we all gave them a clap on the back. We commended their heroics, and rightly so. And I've met many of them, and I can tell you that they are hungry for change in healthcare. They want things to be different. They want the tools to do the job. They don't want any more claps on the back from politicians. They want us to do our job, which is to provide the resources to the public system to enable them to give better treatment to patients. They're on the cold face of this. We're talking here about 1.3 million people who are on hospital waiting lists and community waiting lists. The people who are dealing with these patients every single day are staff, and they want the tools to do the job to provide better healthcare. One of the features of the Irish healthcare system, Minister, is outsourcing. It's something that we're very good at. We outsource treatment to private hospitals, and even in your plan that you announced, we're going to see more of that. We outsource diagnostic tests, even though we have 225,000 people waiting for a diagnosis. We outsource cancer screening, and let's be honest, we saw the consequences of that in recent years. We outsource employment of staff through agencies, which cost huge amounts of money. So more and more outsourcing, Minister, means less and less capacity in the public system. But we don't just outsource hiring staff or outsource services. We also outsource responsibility. And it seems to me we have an absolute failure of accountability and responsibility within the Irish healthcare services. The people at the top who run the health services get mega salaries, multiples of what anybody in this chamber will get, and yet we don't have accountability or transparency. At the top in the health service, where targets set are missed over and over again, and it permeates right down into local hospitals, where again we can see major problems in some hospitals, and I have to say, in some cases, Minister, it's simply bad management. If I was the Minister for Health, of course I would put capacity into hospitals where it's needed. Of course we have to look at minor injuries units like the ones in Monaghan that need to be properly supported, and if I was Minister for Health I would do that. But there's also an awful lot more we can do. We have to bring about a new culture of accountability and transparency in the Irish healthcare system. You outsource responsibility for the waiting list plan and Sláinte Care to the two people whose responsibility it is to manage the day-to-day running of our health services, the Secretary-General of the Department and the head of the HSE. You should have taken responsibility. And of course the people who were leading healthcare reform, the people whose sole job it was to drive the healthcare reform, left. They resigned from Sláinte Care because they saw that you and your government were not committed to the reforms which are necessary. They did not see action on waiting lists, and they're right. They did not see action on e-health, and they're right. And they did not see action on regionalisation. And I have to say, Minister, when you outsource responsibility, and then when there is failure, you as Minister for Health have to take responsibility. I said earlier, and I was 100% sincere, I welcome and I celebrate every additional cent that has been put into our health services over the last 2 years, and I recognise that additional investment was made. I also celebrate every single additional staff member that has been brought into the health services, and we need many more. But we also have real problems with recruitment and retention. You know, Minister, that, and you've railed against this yourself when you were in opposition. We're not training enough healthcare professionals. We need to train more. There are real problems with recruitment. We need to deal with that. There are real problems with retaining staff. We need to deal with that. We don't have enough surgical theatre capacity, diagnostic capacity. We don't have enough beds in our acute hospitals, so patients can't be admitted quick enough. We don't have enough capacity in the community sector. We don't have the cohesion and the integrated healthcare system that we need. And unless we deal with those structural problems, you are going to come in here with reports and with strategies that you believe in your heart will work, but I can tell you that they will not. Listen to the Irish Nurses and Midwives Organisation, listen to the Irish Medical Organisation, listen to the Irish Hospital Consultants Association, who are all saying that your plans and your strategies will fail because you are not making the investments and the changes in healthcare which are necessary to take people off trolleys and off waiting lists and deliver better healthcare for patients.
That completes the debate on this topic. So, isi an Keshtanish, Gun Topher and Lassu, that the amendment in the name of the Minister be made. And will Shin Inthia, is that agreed? Not agreed. Not agreed. The Chakti authority, it heave na Keshta Obrigito? The Chakti authority, Gwynna Obrigini? Neil. Is Ogable and Kesht Richa, the amendment vote on. The vote on has been called, so that will take place tomorrow. Sorry. Yeah, tomorrow at the usual time. Well, it's actually, the usual time. Yeah, got a mug. I think, just number one. Yeah. Just number